Hello viewers, Dr. Mashhood again with a video on COVID-19. Today we're going to talk about an important topic which is when and which type of test do we need to do for COVID-19. Now there are two different types of tests which are normally available all around the world. The first one is RT-PCR and the second one is the antibody test. We're going to talk about what each test is, what are the caveats, what are the advantages, and what are differences between these two tests. Let's start off with RT-PCR. RT-PCR stands for Reverse Transcription Polymerase Chain reaction. It's a test which is normally done to detect the presence or absence of COVID-19 infection. It normally is recommended when the patient starts having symptoms which are compatible with COVID-19 to have this PCR test done, or if they have been in close contact with family members or close friends who have been diagnosed as COVID-19 positive. Now this RT-PCR test will only tell you whether you have COVID-19 infection or not. What it won't tell you is whether you have sufficient immunity against COVID-19 infection. Now there is a big caveat or downside to this RT-PCR. The first one is there are a lot of false negative and false positive with these RT-PCR tests. So you can have a positive COVID-19 test, but actually the patient hasn't got COVID-19, and vice versa. The second big disadvantage of RT-PCR is it only gives you indication up to the first 2 weeks since the infection started, whether you are positive for COVID-19 and whether you're going to be transmitting the infection. But after 2 weeks of this onset of symptoms, it is normally understood that what it detects up to 6 weeks, from 2 to 6 weeks, what it actually detects is what is called as dead virus load. That viral load is actually a virus load which is not going to be transmitting infection, but it all comes back as positive if the PCR is done again and again. That's why WHO and certain countries such as UK do not recommend repeated PCR test. The general consensus is to do a PCR test once when the onset of symptom happens to identify whether a patient is COVID positive or negative. Why is this important? This is important because if we do diagnose a patient who's COVID-19, we need to try to encourage them to isolate and to stop transmitting this infection to the rest of the community. Because the successful countries, the countries who have got hold of COVID-19 infection, have actually done a lot of testing to encourage identification of patients in order to isolate them. Now the second test which we're going to mention is the antibody test. Now there are two different types of antibody tests, qualitative and the quantitative. So what is the difference between these two types of tests? The qualitative test will tell you only if you have the antibody against the COVID-19 infection. What it will not tell you is the amount of antibodies you have produced against the infection. The big downside or caveat with qualitative antibody test is that it carries a higher percentage of false negative and false positive test results. The second type of antibody test, which is more popular and has more accurate results, is the quantitative test. So what is a quantitative test? Quantitative test will identify both IgM and IgG antibodies and will give you a number or a reference range for these antibodies. It has a lesser amount of false negative and false positive results compared to its compatriot or qualitative antibody test. Let's talk about these two different antibodies, IgM and IgG. When initially a patient gets infected, the first response from the body is to generate antibodies which are called IgM. These IgM antibodies are produced from 3 to up to 7 days, and they take part in the initial fight against the infection. The second type of antibodies, which are the IgG antibodies, are normally produced between 7 to 14 days. And these antibodies are thought to provide long-lasting or greater level of immunity against the infection. So when should we do an antibody test? As mentioned earlier, the PCR test is normally done when the symptoms start, so as we can identify a patient whether they're COVID positive or negative, isolate and start them on treatment. Whereas the antibody test is recommended to be done anywhere after 2 weeks of onset of symptoms. If we do it earlier, most likely it won't give you accurate results. The later we do it, the better it is, because it will give us greater information about the immunity status. Just to summarize, if the patient starts having symptoms, PCR test should be done. After 2 weeks of symptoms, up to 6 weeks, antibody test should be done. There is no role of repeated PCR test in a patient who is COVID positive. If you have any questions, please send us messages through WhatsApp or mention in the comments below, and we'll try our best to answer your queries. If you can, please share this video and subscribe to our channel. Thank you very much.